Hi everybody. Good afternoon. I'm just arrived in Paris in this wonderful factory, the Carestream factory, to present the certification of quality certification. And I'm here with Yann, with the head of the R&D department. I will discuss a little bit about these facilities that actually are reaching an unbelievable level of quality. What is the path that allowed you to reach this kind of quality today?
Okay, so simply I believe because we have really a legacy of an experience in the design of X-ray equipment. And also I strongly believe that what is making us unique is the fact that we basically control the design of every element of a CBCT, ranging from X-ray generator through the detector, but also, of course, and more, the software to get the best image quality as possible, and also to provide additional information to the clinician to make it clear.
Yeah, I had the opportunity this morning to have a quick visit to, and I have seen that every single screw is completely controlled. So the final control is extremely stressed. I think that
Exactly.
this is extremely important for the customers to have this kind of control.
And this is also the fact that we have an integrated R&D and manufacturing allows also to have R&D being able to provide the tools, to calibrate the equipment, to maintain really very stable image quality across equipment and also customers.
Yeah. And what was really amazing that I found that you prepare everything and you also package everything. And before sending it to him, you unpackage it and check it again. What is this? Never seen. So I can understand that this kind of quality can be reached only through this very careful control of every single thing. And about the new things that actually are introducing, for example, the artificial intelligence, I see that a lot of new things can be, for example, the automatic detecting of the nerve by the device and the position of the patients when is under the devices and things like this. What kind of thing can we expect from you?
Yeah, so you're right. The AI journey started with more simple things like analysis on 2D images. So for sure, we started now this journey in 3D, as you say, by detecting the mandibular canal, tracing the auto-arch. And now we are moving to using AI for treatment assistance. Basically here I'm referring to implantology to propose some automated positioning of the implant, for sure on simple cases. And of course, over time, the idea is really to use AI also to merge the information coming from the different modalities. So it can be 2D X-ray, such as panoramic, CBCT, IOS as well. IOS has some clinical information, up to the facial scan that you know and are using regularly in your practice.
Yeah, the facial scan is one of the most important things to communicate to the patients. And so to have in our hands the virtual patients and walk on the virtual patients and try to find exactly the same things in the reality. Is there some improvement, for example, to introduce a little better the face scan into the completely image of the virtual patients in the future?
So yeah, facial scan is we are used to X-rays, intraoral scan. And facial scan, I would say, is the next frontier. So for sure, there are a lot of things to do, but maybe the very first thing is to also integrate it into what I'm calling the ecosystem. For instance, I'm thinking to smile design software to make sure that this facial scan can be mapped with the CBCT and the intraoral scan. And of course, we can envision some application allowing for the dentist based on his treatment to be able to see, depending on the different treatment option, what would be the impact on the aesthetic of the patient. This could be quite a nice application.
So, okay, in the future, the artificial intelligence application are going so fast, and so what is going on and what we from university, from during our courses is, okay, the artificial intelligence can help you extremely in an extremely good way, but do not forget the basic science. So what kind of recommendation would you do to the new generation that think that today you don't need to do everything, because in theory today you can send someone to a CBCT center, you can have all the information, then you send everything to a robot. We don't need the human.
Yeah, I think the simple advice, and I think you do the same to your to the student or young dentist, is try to keep a critical mind by saying that, of course, AI can help to automate, to gain time, even sometimes to find, for instance, some pathologies, in the CBCT that a dentist did not catch. This can happen, but always be pretty critical to challenge also the outcome of the AI. And also, I think as a manufacturer of equipment, it's also a duty to make sure that we present the information in a way that you have always a chance to decide or not if this information is right, by providing not only the data from the AI, but also the image by itself. I can take an example. You are probably using the MAR, the metal artifact reduction.
Yes.
We allow the dentist to show the processed image by the MAR, but showing as well the non-processed image, so that also the dentist can make his judgment and decide if the processing is right or not.
Okay. So congratulations for this certification. You know that this certification for us is extremely important. We, as the DDS, we make a long path to come to these recommendations, because we previously organized a quality process just to set the rules, the minimum level that these devices need to do. So today is extremely important to buy the right devices. Otherwise, the information that you have are not exactly the one that you need. So what kind of recommendation would you give to someone who have to buy and is not very well oriented? Because today we know that there are, I don't know, more than 250 or 300 different. So this certification would like to put some kind of control of the minimum level of these devices to be, because it's for someone who had to approach this kind of digital solution. Today you may find this price, and you don't really understand what kind. Is there something that concretely someone can take care before doing this kind of purchase?
Yes, so I think you already summarized. You're right, there are plenty of CBCTs, and the fact that this certification exists and that we follow this testing protocol allows us to demonstrate that we are meeting this capability and this level of quality. Now, for sure, beyond this recommendation, I think it will be also good that progressively this recommendation can be also, let's say, integrated in the equipment, so that the user can benefit from them, maybe even without knowing it, and making sure that the device is going to behave consistently with your recommendation.
Mm-hmm. Okay, and we hope that also this the existing of this recommendation will elevate the level of everybody, because probably the other one who do not have this, it's extremely easy for a company like you to reach this level, but probably the other one should, in some way adapt their way of doing this kind of device, maybe in the future. So, okay. So, thank you so much. Congratulations for reaching this
Thank you very much.
Thank you. And okay, see.